Good. All right. All right. Good morning, everyone. Thank you for joining us. We're excited. This is actually our second forum that we are having as a hybrid model. So we're very excited to have you all here today. Good morning. I'm Andrea Perdomo Morales, the co-chair of Communities Concerned for Immigrants and Refugees. Communities Concerned for Immigrants and Refugees is a learning network open to health, social services, and other community members interested in strengthening the health and well-being of refugee and immigrant communities. This work is led by 10 health advisors. We do have one of those health advisors in the room with us today, Erica Andrade from El Centro. And it's a, yes, round of applause for Erica. We meet on a regular basis and really are able from our 10 health advisors to really have a pulse of what's going on in our communities, what the needs are, and strategize on what forums we need to have, what we need to learn about, what best practices are out there. So we are very thankful to those 10 health advisors. We also are, this work is made possible to us by funding from the REACH Healthcare Foundation. So we do want to give a round of applause to the REACH Foundation. Several years ago, the REACH Foundation and their board decided that one of their target populations was going to be to ensure that we were funding immigrant and refugee work. And I will say, as working in a nonprofit sector for over 20 years, this is the first time that we have had a foundation really dedicate dollars to immigrants and refugees. So we are forever grateful for the REACH Healthcare Foundation and their board for making that commitment. With that in mind, CCIR is proud to present this morning's forum focused on strategies to increase engagement with immigrants and refugees. We have 3 informative speakers this morning. They represent education and health sectors. We feel their variety of experiences in these social service sectors will provide beneficial strategies that can readily be applied in multiple environments. We will start with Kelly Cooper. Ms. Cooper is an English as a new language teacher at Lafayette International Community High School in Buffalo, New York. She has taught in Buffalo Public Schools for 10 years, and during that time has piloted a heritage language program. This past summer, she ran a volunteer virtual school for over 100 students in Burma, Myanmar, who were unable to attend school because of the recent coup there. Prior to teaching, Kelly was a case manager and refugee school impact program coordinator for Journeys End Refugee Services in Buffalo. She has a BA from Syracuse University in International Relations and Anthropology and a master's degree from the University of Buffalo in teaching English to speakers of other languages. She lives in Buffalo with her husband, a former Burmese refugee, and their emergent bilingual 2-year-old son. Next on the lineup is Antonio Miras Miera, otherwise known as Ton. Ton was born and raised in Galicia, Spain. He studied sign language interpretation at the Universidad de Vigo. In 2012, Ton moved to the US and began working as a community health worker with the KC Care Health Center. Since 2016, Ton has been supervising a team of community health workers whose focus have been to assist the underserved population in Wyandotte County by empowering patients to get access to care and to address social needs amongst the African American, refugee, and Latino communities. His enterprising work with patients at the ER at the University of Kansas Hospital earned him the honor of KC Care's Health Center's Employee of the Year in 2015. Currently, Ton is the project manager of the COPE project at KUNC and is currently developing the program to hire 60 community health workers throughout Kansas to address clients' social determinants of health and COVID-19 testing and vaccination. Ton also is the project coordinator for Juntos, Center for Advancing Latino Health. Our third speaker this morning is Justin Guest. Justin serves as El Centro's Director of Community Health, overseeing the Health Navigation Program, Inscríbase, or Get Enrolled. He also is working with Poder en Salud COVID Education Project and El Centro's Vaccine Equity and Access Project. He is an Olathe, Kansas native and received a BA in social work from K-State. He has served as vice president on the board of directors for the Coalition of Hispanic Women Against Cancer, assisting Latina women gain access to cervical and breast cancer screening and education. He has also served in Mexico volunteering with community and health education programs. In the interest of in following their COVID safety protocols and the requirements here of our location, there will be a brief question and answer period at the conclusion of each speaker's presentation. For those in-person participants, please feel free to stand up and ask your question loudly, and our presenter will respond. For anyone on Zoom, please enter your question into the Q&A chat box on the Zoom screen, and we will make sure that your question is answered. The speaker will repeat the question and answer from the podium. We thank the Reach Healthcare Foundation again for their goal to improve the health and well-being of immigrants and refugees in the Kansas City metro area. We are very happy to be here today, and I'm going to turn over the stage to Kelly Cooper. Thank you.
Thank you. There we go. Hi, everybody. Thank you so much for having me. I'm going to be talking about engaging multilingual families, especially in a school setting. As was previously said, I'm an English as a new language teacher at Lafayette International in Buffalo. Oh, sorry.
Might mess up with that switch on the
It's fine. It's fine.
might have to do it like that here.
Oh, that's fine. I just have a picture here. One of my students on Monday came in with a Kansas City shirt, so I had to take a picture to share with you all. I really enjoyed being in Kansas City, and I was like, I have a secret. I'm going to Kansas City on Wednesday. He was very confused, but I had to show you guys. So again, about me real quick, my background is in refugee resettlement. I worked as an AmeriCorps Vista and as a caseworker for a refugee resettlement agency for 5 years before I became a teacher. And I do have a multilingual family. So my husband came here from Burma, which we call for political reasons, in 2006, and his parents live with us. So my son is growing up bilingual in Burmese and English. My school is named Lafayette International Community High School. When I started, it was a school that had a large number of multilingual students coming into it. And because of low test scores and graduation rates related to that, the school was shut down and changed into 2 new schools. So the school is now a community school, and it's part of the Internationals Network, which is focused out of New York City. So that means we work more towards project-based learning for the students. We still have to pass the exams to graduate, but the cities in New York are working, don't have to, and they get to do projects to be able to show the students learning better than on an exam, which is awesome. And I should say before I go on that all of the links and things that I talk about will be sent out in a Padlet. So there's more information about the Internationals Network there. So our school is a 9 through 12 community school. I'm going to talk about what a community school means in a little bit. That means that all of our students start our school having been in the mainland United States for less than 5 years prior to starting school. It's about 50% with a bilingual program for Spanish speakers and 50% refugee and immigrant, 100% multilingual learner. Before my school combined with a newcomer program, which was for students who had just arrived in the mainland, in the country, really. And our top languages were Swahili, Arabic, Somali, Kinyarwanda, Tigrinya, and Bangla. And so those are the main languages. We're getting a lot of Afghan, a lot of from the Congolese diaspora, and a lot of students from Burma as well, combined with the 50% Spanish population. So that's the population I'm working with. I think it's pretty similar to the population of refugees and immigrants you have here in Kansas City. So I just want to acknowledge the elephant in the room, the difficulty of family engagement. And this is something that everybody knows. And that's why you're here. Of course, there's a language barrier for many of our families. There could also be a cultural barrier if there are families who don't feel comfortable coming to school, or they feel in their culture that the teacher's responsibility is the school and their responsibility is the home. That's something that's very common with our students. There are some families that are more afraid to come to school or to government a property, maybe because of lack of documentation or for other reasons, maybe something happened in their home country in a school. Of course, there's a transportation issue. I suspect that's the same in your city, of getting to school, especially if the school is far away from home. The time, of course, time it takes to come to school and to do parent-family communication, it can be hindering. The resources, always a problem. How many of you have ever tried to call a family and the phone number is disconnected? That is a very common problem. And then of course, schedules. Many of, I know my families, some of them work nights, and it's just trying to find the family engagement. So of course, there are many, many other reasons why family engagement is difficult, but I just wanted to acknowledge it, that I know it is something that is difficult for me, and I suspect for many other people. And then to make it worse, of course, we're in the middle of a pandemic. And I made this slide a little bit, I didn't want to take out the things, but we have even more difficulty during a pandemic. The students may have difficulty with devices or Wi-Fi in their home. Parents may be essential worker disproportionately. A lot of our immigrant and refugee families and some of my students were essential workers during the pandemic. I know in my community, there were higher rates of COVID-19 in the immigrant and refugee populations. The students also have other responsibilities, and family may not be able to assist with schoolwork, and after school programming and tutoring were often shut down. Hopefully they're coming back. So I just want to acknowledge that there is a really difficult problem. And I always like to talk about this when I talk about refugees and immigrants, especially refugees. This is how I usually frame that our students have undergone a series of traumas. And it's just, there was always the pre-flight, something happened in the original country before the families left. There's also the trauma of fleeing to a secondary country. And then there's the trauma of resettlement and changing your whole life. And all of this together is the triple trauma paradigm. And then there's the added trauma of this pandemic. So we are facing a lot of difficulties right now, which all of you know, which is why you're here. So I'm going to move on. The thing that I have this graphic posted in the Padlet. I just love it. So one of the things I decided to do, I took a class through the Caring Institute. It was called the Refugee Educator course, and it's wonderful. If anybody wants to look into it, it's a great program. And one of the focuses was on engaging the family. And I thought, this is something I need to do. It's something that, you know, I've been working on, and it's something that I need to focus on as a teacher, because I think, you know, it's so important. So that's where the basis of this came from. And of course, you wouldn't be here or virtually here on a Thursday morning if you didn't know that it is beneficial to engage families. So I don't need to harp on this, but of course, it's showing respect to other humans. It's funds of knowledge, which I'll touch on in a second. It's motivating to the students and to the families to engage their families together. It's teamwork between the school and the community and the parents. And it creates community, especially for new refugees and immigrants to the country, or Puerto Ricans. In our case, it's largely Puerto Rican population, so I don't mean to leave them out. Creating community in their home, in their school, and creating that bond. There is an article in the Padlet that I will send out about funds of knowledge if you haven't read Lewis Moll's Funds of Knowledge. Again, probably I'm preaching to the choir, but our families come with so much knowledge and background and information that they carried with them. And we have the opportunity to use that in our classroom and to use that in our community, and we need to do that. You know, there are people who say, oh, like they don't have anything, that's the deficit model, but we need to dig in and see what is the hidden home community resources that our families bring with them. And that's something you can do when you engage families. So communication can be so difficult, like trying to find, you know, ideally you're going to find the best possible language to speak to your families in. And how then do you communicate in that language if that language is not one you speak? What languages do your families best understand? And then how on earth do you find contact in that language? So one of the things I do is, this is a picture of it, and again, I will send it to you. I have my students fill out a language portfolio. So they list every language that they speak and how well they speak it and how they speak it. Do they speak it with their family? Do they speak it with their friends? Did they learn it in school? So that I have like a variety of languages. You know, again, of course, I would much prefer to speak in the language that the student best speaks, but also sometimes what is the language that the family and I both mutually can understand, or the best resource. So just to get a list of all the languages the family speaks, because so many of our families come in multilingual with so many languages, and that can be a resource. I just wanted to touch on the difference between an interpreter and a translator, which again, maybe you know, but it's something that kind of, so an interpreter is oral and a translator is spoken. So I'm going to give tips for both interpreting and translation. These real quick are some just general tips for communication. It's important to invite the families to your school to make them welcome early, like especially if they first come to the country or first come to the mainland, and invite them in often, give them the opportunity to come to school and make them feel welcome in the school. Be welcoming. I was thinking about this report I read where families were, this group came into schools and nobody welcomed them when they walked in the main office. And I think it's so important to just say hello, like welcome the families. And ideally, did I write this here? Ideally, if you could say a few words like hello, Jumbo, you know, something in their home language, that would just be great. Like even a smile and a hello goes a long way. That seems silly, but I wanted to say it. So yeah, I just said that. Finding the right interpreter. You want to find an interpreter who speaks the language that the family speaks and the right dialect, of course. I was thinking of this case where I had a family who speaks Kizigwa, but they did not want to say that they spoke Kizigwa for cultural reasons. So they were identifying as Somali speakers, and the mother did not understand Somali. And so I had to work with the family. We have an interpreter who speaks both languages and could identify as a Somali speaker and then speak Kizigwa with the mother. So sometimes it's a little difficult. We also have that problem sometimes with like students who identify as solely French speakers, but speak maybe Lingala at home, and to find an interpreter who speaks both and be able to say, here's a French speaker, and then they're able to communicate in multiple languages. That can be really tough, but I just wanted to say it. To find out if your family members can read, if there's a family member who can read the home language, obviously that's not always possible, but it's good to know, and what languages those family members speak. Connecting, if possible, families with staff members who speak the home language so that they have someone that they can easily reach out to. And if you're writing a message, if you're writing a text message, to make sure that the messages are short, clear, and you don't use idioms. There's a podcast that I also will link to. They were talking about this and they said, don't say to the parents, I love your child to death. It's like not gonna translate well. So yeah, no idioms. So these are some strategies for family engagement that my school has, and I'm going to link to some of them. Our district has a language access plan. I think that's something that the district should provide. So like, what is the plan if you do have a family that you need to engage with in home language? And I did provide ours. Our district has also hired cultural resource specialists in the top 8 languages of our Ls, multilingual learners, so that they are downtown and they are able to translate things into the main languages and make phone calls like robocalls, and to be able to clear up cultural issues if needed. We also engage community leaders into our school, inviting, for example, the Karen Community Center leader is a friend of mine. So I had a friend text me and say, we have a Karen girl, she's new here, she just moved from another state, and she doesn't have any friends and she doesn't go to church, like how can I engage her? So I put them in touch with the Karen Community Center just to be able to make friends and connections. We also have a program through, actually, this is where I used to work at the resettlement agency. We have a grant called the Refugee School Impact Grant that hires academic coaches, again, in some of the top languages, and it goes, those 4 people are shared among all of the schools in our district. So we barely see them, but they are great to have in case of emergency. Like I had a student who went missing one night, thank God she's okay. But we were able to get the academic coaches in with the family to talk about it, and she was fine, but she had just slept over at a friend's house because she was afraid of going home late. She's okay, but we were able to like build that cultural barrier with the academic coaches. We also have multilingual teacher assistants in our schools, when possible, to hire like people who speak the home language that the students can identify with. Of course, I just wanted to make sure everyone knew you can make phone calls, send text messages and emails. I'd forgotten about emails because so many of my families don't have emails, but that could be a possible way of reaching families. My school also, this is, I think, an international thing. We have a mentor program. So each teacher is assigned like 5 to 10 kids, depending on how much difficulty those students give us. No, that's not the right way to say it, but we have like mentorship programs so that each teacher really can reach out and make strong relationships with about 10 of the students. And then there's just somebody to like make sure we're touching base with each family and each student. And then I'm going to show this. This is something I worked on a couple of years ago, which is what's called the parent engagement binder and not the family engagement binder. And I will share this. One summer they hired me to just go through and make a list of like notices that would be the most necessary, like things like we're going on a field trip on Friday, or next week is school spirit week, things that you need to say to a large number of families often, and that people across the district would need to do, or like you need to clean out the kid's backpack, that kind of thing. And we just made a list of those, and we had our cultural resource specialists translate them into the top languages, so that ideally you could just print it off, highlight the language, and send it home with the student, just to try to facilitate that. So I will share that. It is a little bit old, but if it helps people, I would love to share it. And then one of the things that I started working on when I tried to really focus, after taking that class, I tried to really focus on family engagement. So I started doing home visits. I will say this was February 2020. So maybe you don't want to do home visits right now. I totally understand that. But I had a group of students who I had taught for multiple years, and I started doing home visits. And I also started visiting restaurants that my students' families owned. And I know my husband used to have a restaurant. It's so much work, you're there all the time, there's no way to get out and go to school. So I went to visit, there was this is food, I think, from the Yemeni restaurant that one of my students had. And his father was so happy to see me, and we were able to talk about his child, and I got to eat delicious Yemeni food, so it worked out really well. We also had a family who runs a Syrian dessert sort of kiosk, and that was wonderful, and we got to engage with the family there. So visiting the restaurants, visiting with the families on their turf, and of course going to community festivals. This is a little picture of a couple of the ESL teachers from my school. We danced in the Burmese Water Festival a couple years. It's been canceled for COVID. And then I have to show this picture of this beautiful woman. This is Rebecca. She's 114 years old. She's the oldest refugee ever resettled in Buffalo. There's an article about her that I will post here, that I will also send you. And she's holding my son when my son was 8 months old, I think. This was a long time ago, again, pre-COVID. So she was so happy to meet them. And I have taught, I think, about 8 of her great-grandchildren. In fact, I have one in my class this year, and I didn't know that he was part of the family, as I call them. And he mentioned something to me, and I said, "Oh my goodness!" Like, it was the second day of school. I said, "You're so and so is your sister?" And he was like, "Yeah, I told you that before." I'm like, "You didn't tell me that. Maybe you told me last year and you were wearing a mask. I don't know who you are." And then he said, "I did wonder why you had a picture of my great-grandmother hanging in the classroom." I was like, "You need to identify yourself." So this picture has been hanging in my classroom. And for the past 4 years, I've had members of her family come through. So for the record, her favorite parts of the United States are Mountain Dew and washing machines. So she's great. So one of the other things that is a typical way of engaging families is parent-teacher conference night. And one of the things that my school has done very well in the past, again, pre-COVID, is making it a potluck. And I have this memory of, especially when we first started getting Syrian refugees, we had a lot of Syrian mothers come in with trays and trays of food. This is not actually a picture of it, I couldn't find a picture of it, but they were able to come into the school and proudly share with the teachers, and we got to eat all this amazing, delicious food. And even if we didn't really have interpreters, we didn't really get to talk to the families felt engaged, and they were providing for us, and they were able to bring their food in. And so every year we did a potluck because just the families were able to engage and felt very welcome and were able to share with each other. Of course, it's important to get interpreters if you can for all the languages when you have conference night. We also had, and again, this is not ideal. I don't know if this is true here, but our seniors, in order to graduate, have to get a certain number of volunteer hours. So we were able to have them volunteer to welcome the families when they came in on parent-teacher engagement night. And there were some times where they tried to have a multilingual parent-teacher night for the whole district, and they provided buses and interpreters. That is, I'm sure, cost prohibitive for many people. And then, of course, now that we do live in COVID times, the ability to have virtual conferences means that some families may be able to engage more if they have like transportation issues, but maybe less so if they're having technology issues. So that is just an option for parent engagement night. And if people have other, I would love to hear more ideas. So I mentioned earlier that my school is a community school, and this is something that our superintendent brought with him when he came here. And I don't want to like, it's an amazing program. So there are 5 community schools, one in each section of our city, and my school happens to be one of them. And they have ESL classes after school and on Saturdays for adults. They have GD classes, legal advice. There's like volunteer lawyers who come in, academic tutoring for the students, clubs. There's like a space club, and sports. There's soccer. I don't know if you guys, it's soccer in the gym. And then they also have Saturday academies, which is all of those things on a Saturday morning twice a month, which have now started up again. And one of those things that we had on Saturday Academy, I mentioned briefly earlier, was the Saturday Heritage Language Program. And this was an initiative that our multilingual department started working with. It was bi-monthly K through 8 language classes for students who were born in the United States, who don't know how to read and write in the language of their parents. So we were able to have classes in Burmese, Karen, Karenni, Arabic, Swahili, and Somali. The Karenni class was not originally in the list, but we had a Karenni community member who asked to come in and do it. So there was an ESL teacher and a speaker of that language in each class, and then the students. So I was working with the Burmese population, and it was interesting because a lot of students whose parents speak Burmese, but also are of ethnic minorities of Burma, wanted their children to learn Burmese. So it had a lot of difficulties because the students some students spoke Burmese at home, but didn't know how to read and write it. Some knew no Burmese because they speak other languages at home, but their parents spoke Burmese. And I have to say that coming from a classroom where my students speak 30 different languages and teaching in a class where every parent speaks the same language, it's much easier and where my co-teacher speaks that language, it's much easier to communicate with the parents when everybody speaks the same language. I just want to acknowledge that I saw something earlier. There's an article I think I'm sharing too that said like one thing you could do to engage multilingual families is to speak Spanish. And I was like, oh, that won't help me. That will only help 50% of my class. So like I just wanted to make sure I said it's much easier to engage families when everyone speaks one language. And here's our little, this is from Valentine's Day where they had to write, I love you on Valentine's. So, okay, now I'm going to get into some technology to help with engaging families. So one of the first steps in, both of these are virtual interpreters. So in my school, we use language line solutions. They have more than 240 languages. So if we don't have a speaker of the language in our school, for example, I have a Burmese teacher and an Arabic speaker who I co-teach with, but Arabic speaking co-teacher. But if I needed to speak Kinyarwanda, for example, if family only speaks Kinyarwanda and not Swahili, it's more difficult. So I would use language line to call the family, call the interpreter, you put them together, and it connects with a live interpreter. One tip I wanted to add, if you do have a Karen population that teachers have been saying to me, make sure that when you are requesting a Karen interpreter, you say Karen interpreter, like the woman's name, because otherwise you're going to get a Korean interpreter, and that doesn't really help. Another program which I have not used, but I saw a presentation on is Propio. It's similar They have remote and written interpreting, they have video remote interpreting, and they have more than 200 languages. So we do have a district license for this, so I think it's something that you'd have to look into for that if you're not using it already. This is another thing I saw a presentation on over the summer and I really liked. It's called S'more. So you can do a classroom newsletter and you could send it in a message, or it's a website that the parents could check. And it does use Google Translate, which obviously I know Google Translate is not great, but it is easy to click on. I just put a little thing at the bottom where you can click on the translate button and it will translate using Google Translate every information. So if you have a lot of families who can read languages that are translated by Google Translate, it's a cool option if you write everything on there. I will say that I was using it for my class's notebook, and then after 50 views, I had to start paying for it, and it was a little bit cost prohibitive for myself. But maybe if there are multiple teachers together and you wanted to use it, I think it's a cool idea. And so I wasn't able to share my class newsletter, so I shared the Auburn West, which is our group that works with us. So this is their newsletter, and you are able to translate it. So it's kind of cool. One of my favorite things that I use to engage families is Talking Points. Talking Points is free for teachers. I do have, again, a district license. My school does, and the difference is with the district license, when we log in, I can see what all other teachers have said. So I can look and say, oh, this teacher already, like my co-teacher already messaged that family or something. But it is free for teachers if you just want to sign up by yourself. It has 100, so I should tell you what it is. It's a text messaging program using a fake phone number so that the students would not see your phone number. And it translates into more than 100 languages. So you would write in English if that's your best language, and it goes out into the family's phone and it arrives in their language. So it starts with Google Translate, and then they have human translators that work with them to sort of like spot check. I will say I don't think they would check 100% of the messages, because I have had a couple miscommunications there, but they do have translators that work with them to check the messages. So sometimes if I send a message, it doesn't immediately get to the family because it has to go through a human translator. But it is a really cool program for especially families who are literate in home language. If the families download the app, so I had an example of a student who was Karenni, and their family spoke Burmese. They understood Burmese, couldn't read Burmese. If I send them a message in Burmese and they have the app, it will read to them in Burmese. But they have to then, it kind of is difficult to, like, I had to meet with the mother and download the app on her phone and sort of show her how to do it. But they do have like letters in 100 languages that you could send out telling them how to do it, but it doesn't work if they don't already read the language. You can also do message scheduling. So like, for example, if you're working on a Sunday night and you want to send a message in the future, you guys know what scheduling is, you could just send out the messages. And you could do a message blast. So like you could send the same message out to every student, but then when they reply, it goes directly to you, it doesn't like reply all. So there is privacy issues. Again, in this podcast I was listening to about it, it said like if you had 5 students who misbehaved in class, you could send one message to all 5 parents, but when they reply, it wouldn't go to everybody. And it is not your phone number. So I have sort of given up on hiding my phone number for my students, but some teachers would prefer that privacy, and I totally get that. And so the parents would reply in their home language to the phone number that you sent it to, and or in the app, and it comes back in English to you. So one example is in the beginning of last year, I sent out a message blast to all of my students, and I said, you know, hi, I'm your teacher. I can't wait to meet you. It's COVID, so I was like, I can't wait to teach you. Blah. And one of my former students, I had sent the message to his parent because I was teaching his brother, and he posted on Facebook. He was like, Miss Cooper learned Swahili. Like, how did this happen? And I was like, no, because I said something like, if you reply in Swahili or in your language, I will be able to read it. Wow, Miss Cooper, like, I would love to teach you more. And I was like, I don't really speak Swahili, but it's cool. It's a very cool program. And I just wanted to acknowledge that the website is not talkingpoints.org, it's talkingpts.org. And I will send you a link to that. So I just have some examples. You're able to send pictures privately to the parents. The parents are able to send pictures back. I had a student just ask, like, you know, it's too cold to go to school? Do we still have school? That kind of thing. So another example of a program that I like, that I feel, when Google Translate, everyone kind of knows about. I don't know if anyone has worked with the Microsoft Translator. It's not something that I would recommend like to use all the time, but for example, if I'm in class and there's a student who is really not getting something, I have the Microsoft Translator app, and it does sort of in real time translate what you're saying. So if they had the app, if they had a code, if all of you here, if I had given you a code, you could be looking on your phone and it would be translating into your home language what I was saying. So it takes in what I'm saying and it translates for you. It can, you know, it is not a perfect technology as like sort of like a Google Translate level translation. But it is really cool to see happen. So I recommend trying it. So I do sometimes use that in the classroom if some student is really not, I can just say it and show them. And it's kind of a cool program. So another thing I do, so I really tried for a couple of years when I started teaching not to use social media with the students, but I gave up because especially with COVID, I think Facebook is a great way to communicate with students and with their families, really. It's easy to communicate worldwide. I know my mother-in-law can't read or write English, but she has a Facebook account that she uses to talk to people all over the world. And you don't need a phone number to do it. You just need Wi-Fi. So it works really well, especially if you can't read or English. You can just click on the person's picture and call them, something like that. So I am Facebook friends with my students because and this is because my school is very, you know, I don't recommend everyone should go Facebook friend their kids. Make sure that it is okay with your district and your companies. My school is very open to it, especially, and some of my friends have like a teacher profile that they friend kids on. I don't post anything at all except for school stuff. So I pretty much just friend my students. And I do tell the kids before they friend me in the beginning of the year, I say, I will like to be your friend. If you're going to post stuff that I don't want to see, please do not friend me. I don't want to be your friend. If you're going to post, I don't even want to know. And I did become Facebook friends with some of my students' parents, especially some of my parents who have home businesses have friended me. I do have a wonderful Facebook friend, the mother of one of my students who has a cake business, and I get to see her cakes, and it's wonderful, and I can talk with the student about that. It does include Facebook Messenger, so I can message with the parents, message with the students. During COVID, I had a group text for all of my students, so I could be like, class is starting now. And I have a Facebook group for my class, so I can share enriching items and pictures, and the students can share questions. And my principal has a website for a Facebook group page for our school, and he uses it to go live and make videos to show parents. So he asks the parents to like the page if they're on Facebook, and he can, you know, they can play the videos over and over again, and he explains things to them. So I have a little video that is a welcome back to school video up there that has his face on it. So the students can watch it and the parents can easily attain it, especially during COVID. It was very good. And I was able to share the schedule. We had like asynchronous, synchronous, confusing schedule. I was able to share that with the parents and with the students on Facebook. And again, this is probably not great, but I do have a class Instagram and a class TikTok. I usually use it for enrichment in my class. Like if we're talking about something in class, and then, for example, I'm teaching about the moon in earth science right now, I'm able to post pictures of the moon, and the students are able to tag me in pictures of the moon. And I am able to use messages. So there was a case last year, we had a senior who was just about to graduate, and he stopped communicating with anyone. He was in another state, and no one had communication with him, but I was Instagram friends with him, and I was able to message him on Instagram. He was able to message reply me to be like, you have to come to school, like to graduate, you have to come to school. So the only way we were able to contact him was through my Instagram. So it saved, I was able to graduate, and it was wonderful. I hate TikTok messages, but the students, especially last year when the students were not in front of me, I was able to post like short videos of the main content, and they were able to follow it and watch it. And it did like vocabulary lessons, and they were actually watching it. So I kind of was meeting them there. one of the last things, WhatsApp. I didn't have WhatsApp before the pandemic, but my students, so many of them use WhatsApp. Again, it works on Wi-Fi. You can do international calls, and it is very private, like secure. So I have a friend who is a newspaper reporter. He only uses WhatsApp with sources and things. I have my son's speech pathologist only uses it for like HIPAA reasons, because it is private, and so many of my students and their parents use WhatsApp. So I highly recommend it. I'm able to communicate with the students. When the students gave me their number, I was like, okay, I'm going to get WhatsApp so that I can talk to them. And then there's just a couple others that I don't use, but I just wanted to acknowledge in case other people wanted to share about them. I have a friend who uses Remind. It's similar to Google Voice. Again, you can message parents, but not using your real phone number. Class Dojo, since I work in a high school, I don't really use Class Dojo, but elementary school teachers especially love it. And then of course there's Zoom and Teams and all sorts of things that you can do. So yeah, I think that's good. I would love to answer questions or to hear what other people are doing, because I think it would just be great if we could share. And yeah, are there questions?
I have a question for you.
Sure. Thanks.
So I know that you have been using Google Translate and the Microsoft one.
Yeah.
Is there any other technology that you're using for translation? I think I'm with you on that. I have been using it several times and it doesn't come across well. Like, just for the record, like in Spanish, for example, if you put green beans, which is judías, you don't want to translate judías back to English because of we Jewish. And that's very important. So are you using any other kind of technology, something that is more accurate in translations?
So the question is using Google Translate and Microsoft Translator can lead to some confusing translations, especially when you translate back. And do I have any other options? The answer is I can't find any. I would love if anybody has something that is better. I do like the Talking Points does have the human translators that sort of check it. They definitely don't check every message, but I think it's good just to, when they check, to, yeah, because it's hard with the AI to do that. I don't have any other suggestions. There is one website, Translator, TRANSLTR, I think, and you can translate multiple languages at the same time. It's powered by Google Translate, so it doesn't, the translation is not always good, but it does help when you have to, for example, do a lesson, you have 15 languages you need to translate at the same time. It works faster, but it doesn't work correct. Yeah. Yeah, thanks. Yes.
On that, I would actually recommend Talking Points to people even that aren't teachers, because anyone can create a free account. I know you said it's free for teachers, but like I created one. I had a friend create one that's not even in the field
Oh,
to
great.
test it. So like really the general public could just download it and use it.
Yeah.
And idioms, it doesn't translate. Like I was testing it in Spanish and I said like "ni casi no also," like as a, which is an idiom, and it just left the word in Spanish and didn't translate it to English at all. But for the most, generally speaking, it is better than Google Translate. So you could use Talking Points even if you're not actually texting someone. You could just have an account.
So point of clarification question that what's it called? Talking Points is free to everyone, not just teachers, and it does work pretty well. But again, don't use the idioms because they will not translate, or maybe translate wrong. So yeah, we did have, I couldn't think of the exact example, but I had this one student message we sent out, and that the parents replied something, it sounded like he's getting married or something, and I think it meant something like he is happy is what they meant to say, and when other teachers were like, what is this message? And we had to clarify with the family. That's how I know they don't always check them. But yeah, it is a great program and it's free. So
we do have one of our Zoom participants, sorry, that it says they're using Flyer Connect.
yes. Oh, Flyer Connect is another one. Okay, great. I can add that to Flyer Connect. Cool, thank you. Yes.
Elaborate on the language access plan?
Sure, I can send it out. It's really just something, oh, sorry, the question is elaborate on the language access plan. So The language access plan in my district is something that our multilingual department sent out to all schools so that teachers know what to do, like step by step. If you have a family that you need to engage with, that you don't, maybe, especially for teachers who are doing it for the first time. So it's like, number one, I haven't memorized it. It could be like, check to see if someone in your, like a multilingual interpreter. And then it'll be like, number two, use language line. Number three, contact the multilingual department. So it's just like an action plan, especially for people who, just so everybody knows what they're supposed to do, in case we just have teachers or other people who are like, I don't know what to do, so I'm not going to do it. Then you can just give them the action plan to say, these are the plans that we take to contact families. Yeah.
I have a follow-up question on
Sure.
the language access plan as well. How large is your district?
So Buffalo is, I think, half the size of Kansas City. I had the exact numbers.
Like 8,000 students, 10,000?
Yes, I think it's about 10,000. I'm bad with numbers.
My question is what is the like accountability or data tracking piece on whether or not teachers are using the access plan? Because there are a lot of great plans out there, and many educational institutions say this is what we tell our teachers to do. But then I will meet teachers that are like, oh my gosh, I didn't know there was an interpretation line. And I'm like,
Yeah, so
how do you tackle that?
so Buffalo is about half the size of Kansas City. I don't remember it. So the question is like, what is the accountability? I do know that our multilingual department tracks, for example, how many talking points are sent and exchanged, so that we'll get a newsletter every week like, oh, Lafayette was the best school for talking points, or like they said, because we have a district license, they can count and see school by school who's sending the most. I think similarly, they must have a plan for language line that they can see how often it's being used. And there's definitely no accountability. Oh, I guess we have to post parent engagement in our, we use Infinite Campus. It's like our, yeah, okay. So we have to post anytime we do parent engagement. I don't always do it because, like, especially if you send a message to 100 parents or whatever, like, it's very difficult. But we try to do it so that we can show that we're doing family engagement. So yeah, there should be accountability. And then I recommend all teachers to be writing it down so that you can say, even if you're not putting it in, this is how I communicate with the family. It's very important to keep that documentation and to have it in case you're asked.
We have a Zoom participant that says, thank you for these ideas. And this is an individual from a community-based organization. This gave me the idea to spell out language names phonetically for our staff to pronounce correctly with our language line.
Yes, good. I'm glad that, thank you. I'm glad that, yes, the name Karen is so difficult with so many people. Yeah, it is sometimes difficult to find the interpreter in the right language, especially when you're saying it in the way that you're used to. If you're working with people who come from the community, you're saying it all the time. Just, yeah, for people who don't always communicate with that language, just spell it out. That's a great idea. Yeah. Okay, thank you.
Thank you, Kelly. Moment of transition here. We're going to go up and get his slides up.
See, the only problem with this downstream that didn't quite. Do you have notes on your presentation? No. Don't worry. Let's see if I can get not to use presentation. Did you call it? Awesome. Wonderful. Thank you so much.
Well, thank you for having me here. And it is just so great to see some familiar faces here that I haven't seen for a while because of the pandemic mostly. So the subject that we're going to be talking about today is engaging immigrants in healthcare, specifically the Hispanic community. So before I start, I just wanted to do like a quick rundown on background on what's happening with the Hispanic community, especially when we talk about access to healthcare. So as many of you know, the Hispanic community has many times lack of access to healthcare for several reasons, and I'll talk about that here in a second. But also that is going to create poor health outcomes for the Hispanic community, especially because they are not accessing to it. So some of the barriers that the Latino and the Hispanic community are having is language barriers. Immigration status sometimes can be a barrier to get to healthcare access. Culture, financial resources, and lack of health insurance. Not having health insurance when you are seeking for specialty care, that's a huge barrier. And then fear of being reported, different perception of the medical assistance. Many times from our countries of origin, we see the provider as somebody that is gonna go to your house. You know them forever because they have been treating your family, versus getting access to healthcare care and you just go to the provider and you're gonna see a provider for just 15 minutes and then it's done. So that also is preventative for people to get access to care. When we talk about the pandemic at this point, Hispanics are 3 times more likely to get COVID because of lack of education, lack of access to resources, etc. Fear sometimes to go to vaccination events because they fear that they are going to have to be, or they are going to have to present like a social security number, or they are going to be reported. And then last but not least, Hispanics are the second fastest growing racial and ethnic group in the country. So I'm just going to leave that information right in there, and I'm going to talk about something else, but we will come back to this information as well. So I just wanted to also mention the paradoxes of health among Hispanics. So when we talk about cancer and heart disease, beyond of everything that's happening for the Hispanic community with the income rates that they are having, the access to healthcare, yet cancer and heart disease, Hispanics are doing better than white folks here in the United States. And that's something that is very important to mention. When we talk about diabetes, in the length of a life of a Latino, 1 out of 2 Latinos are going to have diabetes. And if we compare this to with the white folks, 50% chances are bigger on the Latino community to die because of that diabetes and the consequences of it. And when we talk about kidney disease and cirrhosis, you can see here 14.8% of Hispanics versus 10% of the white folks. And the list goes on and on. So we can talk about infant mortality, depending on the countries of origin of the Hispanic community, but also hypertension and smoking, depending even on the Hispanics, if they were born here in the United States versus some of them that were coming from another countries and living here, you can see the difference, like 14.9% for the ones that were born in their country of origin, and then they come here, and then 20.9% for those that have been born here and developed hypertension. The last thing that I wanted to give on this background is the access to health insurance. Latinos are 3 times as likely to get access to health insurance here if we compare it with whites, and 2 times less likely to get health insurance if you compare it with African Americans. On this slide, and I just wanted to put this here, I think this is very important to mention, the main causes of death for the Hispanics. If you begin to see the 2 lists here, you're going to differentiate between female and male. So for females, cancer, heart disease, stroke, Alzheimer's, and unintentional injuries. When you go to males, heart disease, cancer, unintentional injuries, stroke, and diabetes. When you see those first 5 for each of them, many of those can be prevented. You know, with the right care, with a good healthy style of life, these can be eradicated, and also with access to healthcare. So what is the problem? Why am I bringing all this up? The reason why I'm bringing all this up is because when we talk about everything that is happening for the Hispanic community and thinking that this is one of the biggest communities that are growing here in the United States, we are getting people that are not getting access to healthcare. They are going to receive the healthcare access when they are very sick. So therefore, they are going to end up going to the emergency room, getting admitted in the hospitals, et cetera, et cetera. So there is little or no access to preventive medical care. There is no access to health insurance, as I mentioned before. There is disengagement on the healthcare system. Many times as Hispanics, we go to a primary care physician and we don't click with them because of several reasons. And I'll talk about that later. The tendency to wait until, I mentioned this a few seconds ago, the tendency to wait until the disease is critical, diabetes, hypertension, strokes, how many times we wait until the last minute, we go to the emergency room, we get admitted to the hospital, and that doesn't look better even from there. So an increase of medical hospital costs for the healthcare system, right? That is condescending to the point that I made about going to the emergency room. Providers and medical sites and medical professionals, they have the key to address this. We need to engage the Hispanic community into seeking for healthcare. And how do we do that? Before I go into that, I'm going to put a couple of examples here real quick. And this is based on my experience working with clients from the Hispanic community, being with one of them, sitting together, and we're going to call a provider. And the first thing that you get is like, can you hold for a minute? And then the phone is down. So somebody who doesn't speak English and they hear that, they're going to be like, did I get disconnected? What's going on? The likeliness of them hanging up and just calling back again is very high. And the likeliness of not even calling back is even higher. So go ahead and fill this form. How many times did we go to a primary care physician? They give you a form that is in English. They don't even ask you which language do you speak. And I'm not saying that we have to do this every single time, but please just make sure that the person that is filling this out, that they understand what they're filling out, because then this information goes to the provider and it is inaccurate. You're late and won't be able to be seen today. Everybody knows here that we have a limit of 15 minutes, right? When you get to your appointment and you're 15 minutes late, they are not going to see you. I can tell you several times clients that I've been working with, and they have to take a bus or 2 buses to get to the medical site where they see the provider, and that might take 2 hours. It's just enough that one of the buses doesn't show up or shows up a little bit later for that client to go to that medical appointment. They get 15 minutes later and they're like, we're not going to see you. So a little bit of understanding from the front desk crew just to understand those situations is very important. I understand Spanish. We don't need an interpreter. This is very common. I see some eye rollings here. Just to give you an example about this, I went with a client to seek for medical care. The provider was like convinced that he speaks Spanish. This patient had erectile dysfunction. And I just hold back and it was like, okay, I'm just gonna let this go. If I didn't intervene, this patient would have left that appointment with Prozac. So nothing to see because the doctor was understanding that the patient was sad. So that's very important. And then not to have kiddos that speak Spanish interpreting for those medical appointments. That is a huge load for those kids. And that is not welcome. And the interpretation might not be accurate. So this is something that we need to address as well. Comments like, you need to eat healthier, or you are fat, or that doesn't help, not just for the Hispanic community, but for everyone. And so that is going to hold me back from going back to that provider and probably from seeking care again. Asking for the social security number, this happened several times. And I understand that from some testing and things, we are going to need a social security number, but there are different ways to ask this information without sounding like, well, if you don't have it, you're not going to get access to care. Talking about refilling prescriptions and the price of those prescriptions, several times going to a provider and the provider passes the prescription to the patient and says, well, this is going to be $400, and you see the patient nodding. But as soon as the patient leaves the clinic, they are like, there's no way I'm going to afford this. And so therefore, they're not going to take the medication. The last one is not from a Hispanic patient, and I'm looking at Kelly here. There is a Burmese client that was working with me. He got to an appointment. They were going to do x-rays for his jaws and his teeth. And they put this machine on his head, and this machine begins to turn. No one told this patient what was happening or what was the test that was being done. This person, and apologize for the language that I'm going to use, but he freaked out. He was like, oh my gosh, what's happening here? And he stood up and left running out of the clinic. So explaining step by step, what are we doing? Now we're going to poke you in the arm. We're going to be doing A, B, and C. It helps people to feel more confident and trusting more the healthcare system. I bet that many of you relate to these situations. I do. So what should be the focus, right? So the focus is in strengthening those relationships between the providers, the clinical settings, and the community. And how do we do that? I mean, based on what we saw before, there are some cues there that we can do just to improve that healthcare, right? Engaging the immigrant community in assuring access to regular preventive care, and then making sure that everybody who comes to your clinic is treated with respect, and that there's also a good understanding of what is the process, what's happening every time that they are doing a test on me. How am I going to get the results? How am I going to get my medication? So if that were to be what happens, the patient outcomes, the patient experiences will be way better. And also, reduce inefficiencies, because what I was just saying before, erection dysfunction, and I'm living with Prozac. I was there. Probably many other situations, there was no one there. How many times a patient has been prescribed a medication that they don't need to take? And then at the end of the day, we're going to decrease costs because people is going to be treated in the right way for the right disease at the right time. So when we talk about culturally appropriate care, here are some characteristics or some skills that people has to have. And this is, I'm not trying to slap any provider or anything along those lines, but empathy, knowing where our clients are coming from and what are the challenges that they are having, asking questions, that's very important. Being culturally sensitive, not everybody is American, not everybody has this culture. We come from different cultures, and we have to embrace different cultures and to embrace those differences. Self-awareness, how do we come across? How many of you have been going to the doctor and the doctor is not even looking at you in the eye? They are just taking notes. I think that across the board for any culture, that can be inappropriate. And it can be like, okay, this person is not even listening to me. So being aware of that, not just looking at the watch all the time while you're seeing a patient in front of you. So recognizing differences, verbalizing your own nonverbal signs. When somebody's shaking the head, sometimes it doesn't mean no. Sometimes it's like, well, I'm thinking, but verbalize that, because that can be confusing, not just for the Hispanic community, for anyone. Asking questions, do not assume. There was one of the clients that we have been serving, and they were doing like coping or capping on the back, which is like these tiny glasses that they are gonna like do like suction. And one of the providers saw like the bruises, and they fill out automatically a report thinking that the husband was mistreating her. And that cannot happen. You need to ask, okay, what's going on? I saw those bruises. What's, because that patient, the likeliness of her going back, it's going to be very low. So there is a long list of different characteristics, and also being sensitive of, what kind of foods, drinks, objects, and clothes our clients are bringing to the appointments, and what are they eating. I had a patient that he used to eat crickets, and that was something that for him it was like healthcare. The provider just turned his nose. He's like, you need to stop doing that right away, and that's not going to help. I'm not going to go into all of them because I know that the time is constrained here. But sometimes for the providers and for the medical settings, that's not enough, right? So we have to have somebody who are the eyes in the community and helping the community, having a good understanding of what are the needs of the community, somebody that mirrors those needs, but at the same time, somebody who also have a really good understanding of the health system. And so somebody who is bridging the gap. That will be community health workers. We use them in many of the clinics, and we are partnering with them And it's very, very helpful. So what the CSWs or community health workers are doing is they are able to go out and about in the community, working with families, coming back to those clinics and closing the loop with those providers, especially when we talk about diabetes. Hey, by the way, your patient, he didn't know how to get the insulin, or this patient didn't have a clear understanding of the diet. So that's very important to have somebody who is in both worlds, if you want to call it. And then this is a quick definition of what a community health worker is. And it's somebody who comes from the community, who has a really good understanding of both the health system and the community itself. They have a good understanding on how to engage with the community, how to build trust with them, and just making sure that they are coming back to the health system. So that's a little bit of that. And I just wanted to share a video with you. Do we have like a minute and a half? Okay. This is a video of a program that we run in Wyandotte County with community health workers for the African Americans, Latinos, and refugees, and in collaboration with United Healthcare. I hope you enjoy it.
Community health workers are the goodwill ambassadors of the healthcare system. This is what care can and probably should look like.
Their role is to connect individuals to services. It could be clinical services, social services. We're talking about food access. We're talking about house, and whatever the client feels they need to achieve their healthcare goals.
When I went to their house, I realized that they did not have a doctor to see them. They were in a lot of pain and they needed someone to support them and guide them. So that's where I stepped in. I went to their homes and they don't have anything. They don't have furniture, it's like only a couch. Kids don't have any toys. They're very young.
The community health workers are folks who, first of all, care about people. We're folks who want to make a difference in the community.
To me, it's like a fulfillment. Like you get so happy every day. I help people every day. I try to change their life. The client that I saw today had a bottle for her cough. The prescription was helpful, and what confused her was she didn't know where to get it. They just need someone to direct them. They just don't know where to get it and how to get it.
We just help them figure it out, and as best as we can, we try to figure out how to make it as easy as possible to get done what we need to get done.
Sometimes they have the language barriers, and I relate to them. When I came here, I didn't know any English.
These are individuals that usually come from the community they serve. They have experienced a lot of the struggles and the barriers that the community they're serving has experienced. So they give them that knowledge and empathy that not everyone can have unless you go through those things.
To have the community health workers going door to door, reaching out to people, diverse people, helping them understand the program that they have and how to use it has been transformative.
I see people smiling. When they get help, I can see the pain releasing from them.
Just amazing story after story of folks who, without these workers actually seeking them out and helping get them to the insurance and the providers, would never have gotten help.
I'm very fortunate. I mean, for real, I'm doing what I want to do. Coming to work for me is like never going to work.
It's just like this happiness that you see in people's face.
They're able to bring that emotional support that is key for people to do well. I think that's called just empathy. And I think that most of the individuals that go into healthcare or do what the community workers do have that.
You don't know how many hugs I've seen from folks, you know, when they finish up here and they're just so very grateful. But I think the health workers would say that they're just as grateful.
We're working hard to change at the system to help the people that is kind of lost in the system right now, but with the hopes that we can have a better system on the future.
Well, thank you for listening. I'm going to leave it here, and I'm going to open it for questions if there are any questions.
So I don't know how to ask someone if we need something in Spanish. I don't want to offend the people who like, I speak English, I don't need that. I mean, how do you approach someone and say, ask them what they need?
So for, Donna, you're mentioning for a client, for example, who has some needs and asking, or can you?
Well, when you said you bring the form in and no one says, do you need this in Spanish?
Right.
But I don't want to offend someone who does not need it in Spanish, like, well, I don't need that.
Right.
So what's the polite way or?
You know, I'm just gonna say that one of the most important things is always asking, and then if somebody gets offended, to apologize and move on. Right. It's not the first time for me that I did like an assumption, not with the Hispanic community, but with many other communities, and I apologize, you know, and I move on, and people knows that genuinely you are coming from a good place, and you are asking for clarification. You are not trying to be, you know what I mean, offensive or anything on those lines. So that's one part of it. The other part, I will say, it doesn't fall only on the person that is on the front desk that is giving those forms. It falls on the policies and procedures of those organizations that they don't have a form in Spanish already. So probably sometimes the solution is maybe giving both of them. You know, you have it in Spanish and English just in case you need any of those. Does that, Donna, respond your question? You're welcome. Yes.
My question has to do with vaccine hesitancy right now. So how do I approach that? I come from a school and half of the students are eligible for the vaccine. But I mean, all of them are eligible, but only half
Are
have been
willing.
vaccinated. And when we ask them, is my parents don't want me to get the vaccine.
Yes. And that's a big challenge. Oh, yes. So it's about vaccination hesitancy, and how do you approach that with folks that haven't been vaccinated because maybe the parents are not wanting them to get vaccine. At this point, people who's not vaccinated, most likely it's because they don't want to, right? Or because they don't understand, or so. From my point of view, our approach is like beginning as community health workers, beginning to work with them closely, building rapport, and beginning to have those conversations with them after the fact. You cannot go to a family and from the get-go say, hey, why are you not getting vaccinated? Because they're going to say, they're going to shut you down and they're not going to want you to do it. But once they begin to trust you, it's an open conversation. And if they don't want you, it's just a matter of respecting that, right? We are doing a lot of education. We are doing focus groups with the Hispanic community to understand what are the challenges or what are the barriers for them to get vaccinated. And you will be, I can share those results with you if you want to, but you will be surprised on the reasons behind not wanting to get vaccinated. Does that respond to your question? You're welcome.
And also Justin will be talking a lot more about the vaccine as well.
Wonderful.
Thank you.
Thank you so much. Thank you, Brian.
Another little transition for Justin to bring up his presentation. Thank you so much, Colin. We're so sorry it's chilly in the room. We are trying to work on it, but I don't know how fast it is.
No.
Everybody gets their blanket.
Even I was cold. I was grabbing my coffee. And for me to be cold, it's cold. Oh, yeah. You're good. And go ahead and get started. Well, good morning, everyone, and thanks for joining us today. My name is Justin Gust. I'm the Director of Community Health at El Centro. For those of you joining us virtually, hello, and for those watching later, thanks for tuning in. For those of you who don't know El Centro, we are a welcoming center for Latino immigrants and families. We're entering our 45th year of service here in Kansas City, and we primarily serve Latino communities in Wyandotte and Johnson counties. We have programming in 4 different areas that we strategize in, which is community education, community health, economic empowerment, and civic engagement. So we offer a lot of different services and programs in those areas. But today in particular, I kind of wanted to talk about how El Centro really strategizes our engagement and outreach into the Latino communities we serve. So I'm going to be mostly talking from experience and what El Centro does. That's not to discredit anything else, or it's very important to talk about other immigrant groups and refugees, but that's not who El Centro necessarily serves, so I'm not going to talk so much on that today. And to keep things simple, I have three kind of things that I'm going to focus on, three ways to engage. So first, I want to talk about trust. Trust is a huge factor when you're talking about engagement and outreach into the community. You can have some of the best programs and services, some of the best messages and videos and designs, but if you don't have that trust that you've harbored with the community, your message is not going to be well received. Or your programs might be great, but people aren't going to find out about them if they don't trust your organization. So how does El Centro build and maintain trust in the Latino community? We do that through a couple of different ways. First, I'd like to talk about our Promotores de Salud program. We have had our Promotores de Salud program, I believe they're entering their 13th year that we've implemented our Promotores program. And they are trusted volunteers from the community. They are people who represent the community. Oftentimes they're clients that El Centro has already served, or they've been to us and received a service through our agency. And we've established that trust with them. And they're like, I like what you guys are doing. I want to be able to help out my community and provide that information or that service. So our Promotores de Salud receive a lot of leadership training. They kind of specialize in a certain health topic or area that they're going to work on with the community. And it's a very great way for us to outreach and engage. A lot of our work around the vaccines and promoting vaccination against COVID is through our Promotores de Salud. They've made over hundreds of calls every month, inviting people to clinics, telling them that the clinics exist and that these opportunities are available for people to get vaccinated. And that's just one of the health topics that we've worked in over the years. They've also focused on smoking cessation. They've done a lot of projects around eating, so how to eat healthy, how to incorporate fresh fruits and vegetables on a low budget, and really trying to move families forward in becoming more educated and informed about healthier lifestyles. We also have very passionate staff at El Centro, which I think makes a big difference. I'm very fortunate to say I work at a very diverse organization. I'm one of just 2 or 3 white people at the organization, which does put a little stress, but it also helps me learn every day myself of how I'm engaging not only with our clients, but also with my coworkers. And our health navigation program, which has been around for 11 years now, those are some of those key factors to develop trust, is having people who are from the community, that represent the community, who are engaged with those key stakeholders that have the decisions and the ability to change access for people, and also to be engaged with the community. Another way that we maintain and develop trust is that we don't just focus on just providing education or information to people. Oftentimes clients come to us because we're one of the organizations they heard to contact. They heard from families and friends that, you know, if you go to El Centro, they'll help you with this. If we don't have the answer, we'll find the answer for you. Sometimes it feels a little bit like we're a Latino Google, and people call us for phone numbers for places and things like that. But it does go to show that we have become a trusted organization in the community. But it's very important that we're meeting those immediate needs people come in for. So imagine if you went to your doctor to talk about back pain that you're having, and the doctor's like, oh, well, I think today we should do a vision exam. Or I think we should review your patient history again, and I'm going to ask you all these questions. Or at the end of the day, they end up prescribing something for your cholesterol, but they don't address your back pain. How likely are you going to trust that provider or continue to want to have your care there with that provider? It's not likely going to happen. So we recognize that it's important to meet those immediate needs, but then we build off of that. After I've helped someone with a service, be it they come in for a pair of eyeglasses and we're able to assist. Then we have further conversations, because in that service, I found out a lot of information about this client that then can inform me of what services might be available to them. And we can talk about it and develop a plan of what we're going to apply for and how to really build on what we're working on with the family. And then the last tip for being a trusted organization is really creating a welcoming environment. So I really appreciate what Ton was saying about when you go to the doctor and they're like, here, just fill out these forms. You don't even know if the person can read or write yet. You don't even know what language they actually need. And oftentimes, a lot of the barriers that clients have in accessing care are barriers that are put into place because of organizational policies. So if your first question is, what's your immigration status? That's not a good question to ask people to build trust. And how we go about that, we don't ask people their immigration status at El Centro. It comes out through talking about services. So oftentimes, rather than ask, do you have a social security number? Because I need to know if you can apply for this program, I tell them the eligibility of the program. Medicaid requires that you be a citizen or a permanent resident of 5 years or have some type of visa. Do you think you'd qualify? If they tell me no, that tells me what I need to know and we can move on. Another thing is we don't try to just hand forms to people to fill out, but rather ask the question, I have some forms today that we're going to need some information. Would you like any help in filling these out? If their answer is no and they start to fill it out, that tells me, yeah, I think they can read and write pretty well in that language. If they're saying, yeah, I think I could use some help, that tells me what I need to know to help them in that process. And it really just kind of harbors that trust and makes us a more welcoming environment. So second, talking about communication and how to communicate in many different ways. Today, we have great technology. There were a lot of apps that were mentioned by Kelly in her presentation, a lot of different resources that are out there to get messages and information into the community. And you have to try it all. You can't just do one or the other. If we were to just publish a monthly newsletter, how many of our clients would actually read that or see that? If we just did emails, a lot of our clients don't have email access or have email accounts set up. So that would not be the best way to communicate. You have to communicate in many different ways. So how does El Centro communicate with our community? We built an online presence. We have 4 different social medias that we use, but the one that we engage with most with clients is on Facebook. We found that a lot of Latinos have access to Facebook. They are familiar with the platform. It's been around since I've been in high school. So it's been around for a while and it's not going away anytime soon. And that's been a really great way for us to engage with our clients online and to be able to post information. The other great thing about Facebook is that you can post many different things: pictures, graphics, memes, GIFs, you can post videos. It's not just one thing or the other, and that can really make your platform look advertising. The thing with Facebook, though, is you have to look at your number of followers. If your organization's posting a lot of stuff on Facebook, that's great. But if you only have 1,000 people looking at your page or engaging with your page, you need to focus your outreach efforts on trying to build up your base first. So letting people know that you're on Facebook. We did a lot of that with our promotores de salud. Whenever they would run into people, and even as we wrap up appointments with clients, we say, hey, follow us on Facebook because you'll see our next events and our information on there. We also do use Instagram. We don't have as many followers on there. And Twitter, which is more kind of for our administrative side, a lot more messaging goes through there. So you have to kind of know what platform you need, but really it's building that base of followers in order for your platform to actually be successful in connecting. We also communicate with the Latino communities here in Kansas City through our local Latino media partners. So I have some featured on the screen. There are a few others, but we partner a lot with Telemundo and Univision to be able to do online Facebook interviews. They're able to come to our events and either film or help us promote the events. We also partner with La Mega, which used to be an actual radio station. Now they're an internet app, but they still have a very, very big following on Facebook and online. From doing some evaluation work of our clinics and finding out how people found out about the event or the clinic, almost half of the answers were through Facebook, the other half through La Mega on Facebook. So to me, that tells us we're posting things in the right places and we're partnering with the right people to really get that message out into the community. We also do publications, weekly publications in Dos Más Dos, which is a bilingual magazine, or newspaper, sorry. They post in English and Spanish on there. And engaging with these Latino media partners, a lot of them will be willing to engage with you or your organization. But I also do mention, don't take their support and that promotion opportunity lightly as well. They're also looking to keep their doors open and their businesses in operation. So whenever you're able to support them or partner with them, we do a lot of partnering in that sense, but also financially speaking as well. And then the last way to communicate is also knowing who your audience is, but also recognizing the changing needs that they have. So traditionally in Kansas City, the Latino population has mostly been of Mexican descent. A lot of people from Chihuahua, Mexico, who came up here to settle and help with the railroads developments. And today we're seeing a population shift. We're seeing a lot of asylum seekers, all of the crisis that's been happening at the border. A lot of people are resettling here in Kansas City, and in particular in Johnson County for the school districts. They want their kids to have a really great education, and they hear about the great education happening in those school districts. And to me, that was kind of surprising. I'm like, wow, people pick Kansas City out of all the places to go to, but we're seeing that change. And with that change comes different needs. A lot of the population that we've worked with who are seeking asylum from Guatemala and Honduras, a lot of them don't read or write in Spanish. So posting things online is great, but if I'm only posting stuff that's written, that message is not going to get to them. So that leads me to my next point, which is videos for the win. The easiest way to communicate with someone would be to make a video, because orally they can hear it. They're able to process that information. You can even put subtitles in different languages and use the same video and have a greater outreach with people. But that's really where we saw our social media start to take off, was with our videos. They're more engaged than just posting a picture or a graphic or a flyer. And then kind of the last topic I'll talk about is consistency. Because in developing trust, you want to keep things consistent. If you're changing stuff up or you start posting a lot of stuff on TikTok, for example, and then all of a sudden it goes away, that inconsistency is what kind of creates distrust, or, they're kind of like, are they still there? What are they doing? How is this organization still working? So how does El Centro stay consistent? We try to stay consistent with our programs and sustaining our program, not only financially to have a program that's sound and going to continue on, but also with staff and also with the services we provide. What comes to mind here is I've seen a lot of organizations over the years, they're able to hire that one bilingual staff that they've been waiting a lifetime for. The bilingual staff comes in, they start some outreach projects. The organization is able to start an initiative in Spanish, and we're reaching out to the Latino community. But then all of a sudden that staff person leaves. And what happens to that program? It ends. And so people are like, oh, that program that they had, it's gone. I don't think I can go back to this organization anymore, or back to this clinic anymore. I've also seen that happen a lot in the schools with interpreters. You get a really great interpreter who's wanting to have community events, to do potlucks and engage with families. But once they leave, that leaves a gap. And so it's not just sustaining programs financially, but also in how you're delivering the programs and really trying to build your staff up to be more culturally competent and linguistically appropriate to reach people. We try to avoid cancellations and rescheduling. I know it's not always possible, but for example, when we've had our clinics, there have been times where there's like, this looks like it's not going to work. I really think we need to cancel the clinic. Logistically, it's going to be a nightmare. But I often think about those people who've heard about the opportunity or heard about the clinic already and have decided to go. What are they going to do when they get there and they found out the clinic was canceled last minute, or we didn't communicate that cancellation or that reschedule on time? We're going to also lose them. Probably they won't come back, and we've lost that opportunity to vaccinate that person. So I just say that it's not always possible to do, but keeping things consistent or having programs that are long lasting is very important when you're trying to engage and build up trust with the Latino community. And then last thing, just trying new things out, but also being transparent in the process. So say you're able to bring on that staff member who's really robust and able to engage with the community and start some great programs. If you're trying new things, also be transparent in that process. This is a new program for our organization. It's not a guarantee this is always going to last. And I'll give you an example of that from El Centro is food distribution. We're not a food pantry. We're not a food, we don't offer food services. But during the pandemic, we did because we recognized that as a need for our community. Oftentimes, people became reliant upon the food being distributed each week. So if we had those changes or we had to reschedule or cancel, we were very transparent in that process to let people know this week it's not happening because of this reason, but next week it will. And really that kind of helps with their expectations of us, and it continues that trust and that open communication with the community. And that's all I had on my slides. But here's my contact information, and then I'll open it up for any questions people might have.
Justin, I have a question for you. So first off, I am a big admirer of El Centro. I've been working with you guys and collaborating for a long time. So kudos for everything that you're doing and the programs that are amazing that you guys are doing. My question goes about youth and second generation of Hispanics and Latinos. What is the level of engagement that you guys are having, and what are the actions that you take to engage youth and second generation of Latinos?
So how is El Centro engaging with youth and second generation Latinos? From what I've seen on kind of the service provision side is that a lot of them are trying to contact us or come to us for their parents. A lot of students, younger students, high school students, are ones that find out about services or information and relay that to their parents. So it's often a good way for us to engage with them. We don't necessarily have any programming or services geared just towards youth or to engage with youth, but that's also where we recognize the need for bilingual posts because we know not everyone grows up speaking Spanish. It used to be that we would always post stuff in English and sometimes only in English, but we really tried to move to where it's Spanish first. So that's our focus. Often in creating messaging, we want to do the message first in Spanish because we know it's going to make more sense rather than writing it in English and translating it to Spanish because you lose some of the feeling that you're trying to have with those people. By having bilingual messaging and also helping them kind of understand that these services and programs that we have are also available to them if they're needing assistance. But from what I've seen, it's mostly been people trying to engage with us for family members and friends. And that's also proven pretty successful for our vaccination clinics. We've seen kids with the kids vaccines being available now. We don't have clinics that just focus on the kids, rather it's a family event because we know if the parents are going to bring in their kids, they're very concerned about their kids. But when we ask mom and dad about their vaccination status, it turns out they haven't been vaccinated yet. They'd rather vaccinate their kids first and feel it's very important, but for themselves, not so much. So we saw that it was a really great success. We had a clinic a couple weeks ago where we had 314 people show up to be vaccinated, and about half were kids, but the other half were adults. So that's kind of a unique way, and often a lens that we work out of is viewing the family unit or family structure, because we know that's really important and resonates with Latinos. Yeah.
Question. So I've always adored your Promotores de Salud program, and I think it's a really great model. My question is, for organizations that have also thought about creating these specialized volunteers or perhaps paid volunteers for a certain number of hours to help with outreach and engage in their own communities and uplift them as leaders, is there a way, does El Centro do work on training other organizations to create this type of specialized volunteer program? Or is there a place I can get started in learning how to do it authentically and sustainably for like a long-term thing? Because I think it's I think it's great. I think we should value and pay people for their skills. So
Yes, we do have a training program for promotoras. We've actually recently started some training of promotoras in Garden City, Kansas, with a group there. And we're definitely open to training more promotoras in the area. Our director of outreach and education, Elizabeth Reynoso, she oversees our promotoras program. And she can also talk to you about strategies that we use as far as compensation of promotoras' time, because we know not all are eligible to technically work, but there are things that we can still do to compensate their time. And that's a very important part, because we know they're donating their time and their hours to us and to the community. But we also know they have struggles at home and still need to think about keeping their household financially sustained.
I'll reach out to her. Thank you.
Yeah. All right, I think that's all I have, and I'll bring it to Andrea.
Thank you so much.
I know we also were out of time, but you brought up a good question about vaccine hesitancy. And if you go to El Centro's website, they have done a lot of different videos that you all could share. And also they have posters and things that they actually went through a process of making sure that they had Latinos in their posters. And it's really advertising the importance of getting vaccinated. So I would encourage you to reach out that way. Thank you so much to our presenters this morning. Thank you, Kelly, for coming in from Buffalo, and you came in on the windiest day, literally, yesterday. So we appreciate, oh, I guess I could take this off. We appreciate your time. Thank you, Justin. Thank you, Thon, for sharing all of that valuable information. And to all of us that joined us this morning, thank you for coming out to this hybrid event, and we look forward to having more in 2022, so stay tuned. We appreciate everything, all of your support, and we have to do this work together. When we're serving immigrants and refugees, it takes really a collaborative and collective approach, and us all learning from one another. So appreciate you all just making time for this. So thank you so much. Enjoy the rest of your day.